Just say a few things before we get started. Just want to remind everyone we'll take topics on this topic only. Take questions on this topic only. I am joined by Dr. Ram Raju, the President and CEO of the Health and Hospitals Corporation. Very happy with the positive response that the seniors gave to Lincoln Hospital, one of your flagships. We thank you, Ram, and of course our Commissioner of the Department for the Aging, Donna Corrado, and her agency works with this senior center and senior centers all over the city. Just want to say a couple of things in English and a little bit in Spanish, then we'll take questions on this topic. I want to thank everyone here. Neighborhood SHOPP Senior Centers, obviously it's a wonderful senior center, very well run. Want to thank everyone here who welcomed us today. The purpose of this visit was to give updates to the seniors. We all know that Legionnaires tends to affect older people more. And it was important to give these seniors a progress report to remind them of the help that was available. If anyone had symptoms, to remind them that it's very important whenever someone feels they do have the symptoms to immediately seek medical care, whether that's with their own doctor or the easiest thing one can do in this community, go to the Lincoln Hospital emergency room. Again, symptoms, shortness of breath, headache, flu-like symptoms, things that no one should try and explain away or minimize. The simple thing to do is, if you live in this area of the South Bronx, go and get the medical attention right away. And by the way, as Dr. Bassett has said in the last few updates, more and more people are heeding that call. We've been very impressed at how quickly people are getting medical care, and it shows in the trajectory of this outbreak and the fact that things are getting better. And as Dr. Raju and other hospital leaders have found, the reduced number of pneumonia-related cases in our emergency rooms, people are getting care quickly, and that is one of the reasons things are turning around. A couple of other updates for you. Another day, I'm happy to say, where we have no new cases since August 3rd. So a full week, no new cases since August 3rd. We continue, as we said yesterday, continue to get previously contracted cases that are finally diagnosed as being Legionnaires reported to us. So the total number plus 2 today. We have 2 additional cases that were previous, that were earlier, but have now been diagnosed as Legionnaires. That takes the grand total. Come on, people. Turn off your cells, please. That takes the grand total to 115 cases. There are no new deaths reported, thank God, so that number remains at 12. So again, grand total from day one, 115 cases, 12 people passed away, no new cases since August 3rd. Now, 3 more people have been discharged from the hospital, so it's now 79 of that 115 have been treated and discharged and are well. Also have an update. This is a revision of the number of sites in the impacted zone. And again, we'll happy to talk about any questions about in the zone versus out of the zone, but in the impacted zone, in the area determined by Department of Health to be the area where this outbreak has been concentrated, yesterday reported 12 total sites where we had a test positive for the bacteria. That number has now been reduced to 11. One of the sites actually proved to be outside the boundaries of the zone. It still did test positive, but separate from this outbreak. So that number is 11 now. We will still need to update you one more time as the final reports come back from the lab on the various sites that have been tested, because there's still a few tests outstanding. So we're going to have a grand total final number, hopefully in the next couple of hours. So again, that brings the total number of buildings in the impacted zone that have cooling towers to 38, from 39 to 38. As we reported to you yesterday, 22 tested negative, now 11 tested positive, 5 more we're waiting for the test results. Couple of words in Spanish. La salud de todos los neoyorquinos es nuestra mejor prioridad. Estamos limpiando todas las posibles fuentes de la bacteria en el vecindario. Hoy podemos decir que el brote ha sido contenido. Continuaremos usando todos nuestros recursos para proteger la salud de todos los neoyorquinos. With that, we welcome questions. Dave.
Mayor, it was either you or Dr. Bassett yesterday said, basically, you still believe that it's going to be probably one, maybe two of the original 5
Correct.
towers that were inspected will probably be the one where this all began.
Correct.
Do you feel that way today, especially about the Opera Hotel?
Yes.
On that one specifically, and is it obvious because there's so many cases that we've seen there? And if you also, I don't know if you've gotten the note about the owner of the.
Well, let's do the first one first. The Department of Health obviously has been tracking this situation now over several weeks, and when they come to their initial conclusions, it's based on a lot of different pieces of information. I want to give you a quick review of that. Obviously, I don't have all the information that Dr. Bassett has, but I've talked to her several times, and Ram, feel free to jump in with any clarifications. The first thing to say, we said yesterday, we said Saturday, until the final tests come back from the state lab, where literally you'll be able to see detailed information, and Ram can break this down for you, of what specifically happened, patient by patient, site by site, and then you can do matching. Until all of that comes back, we can't give you 100% definitive answers. But what we do know is, one, we have a simple mapping of where the cases occurred, in this case represented by the residence of each patient. Again, we're not going to give you patient names and addresses, we're going to give you broad information, but we mapped and showed publicly the broad map of where those patients lived and how that correlates to the sites that tested positive. And then, maybe Ram, again, I'll say it in layman's terms and I'll have you interpret a bit the temporal spatial analysis, which is literally, you know, Mary Bassett's talked a lot about the disease detectives. They're taking a lot of information in. When were things reported? Where did they occur? They're talking to patients about where they were physically. They're blending all that information, trying to see what it tells them. It keeps coming back, in particular to the original 5 sites, and especially to that one site. But we will give you, there's going to be a real intensive after-action report on what happened here, obviously, because we've never seen an outbreak like this before, so there's a lot of lessons that will be learned. Final judgments will come when all tests are coming back. Why don't you speak to that?
Yes, I think, Mayor, you said it all well, and we
Why
take.
don't you tell them what a temporal spatial analysis?
Temporal spatial analysis is we take the number of patients who are infected, and then we chart them, plot them around that, and then we plot all the positive towers, and then we make a determination. If most of the patients are around a tower, then we make a deduction. That is one of the things. That's what we are doing now. But as Mayor said very clearly, we had to wait for final analysis to complete before we are able to say this positively. But it looks definitely like there is a concentration again around one positive tower, and that is hotel.
The other part of my question is, as you probably have heard, the owner is pretty bent out of shape with the city and says the city hasn't helped them. He wants to know the numbers, the names of the people.
Well, that's not appropriate. It's just not appropriate to give out patient information. We're not going to do that. So let's be clear. I'm sorry he's upset, but the bottom line is, from what we know that this site tested positive. No one's contesting that. From everything we know, this was one of the major contributing sites. Now, when we do our after-action report, we're going to go over everything. Were inspections done? Was cleaning done previously? Was it done properly? To be fair to any building owner, they contract with someone. Maybe it's their own maintenance staff, or maybe it's an outside firm. We have to go back and test those records and see if things were done properly. But what we can safely say here is something has happened here that we've never seen before. And we've got to get down to the bottom of it. And I would think anyone who owns any of these buildings, first concern would be for the health and welfare of their fellow New Yorkers. And that should be the focus, helping us figure out what we have to learn to get to the bottom of this. But clearly, what the city did was identified immediately that this was one of the sites, one of the very first sites identified, and it was cleaned immediately. That was our obligation, to find it and clean it. We did that.
Mayor, one of the things that the owner of the hotel said was that it's been a frustrating experience and they've only been able to talk to low-level people in your administration. I mean, is that what happened? Was it-
I don't, honestly, with all due respect to the folks at the hotel, I don't know why such great concern for the owner of a hotel when we're talking about a disease outbreak that's affected so many people. That's our concern. I don't know who he's spoken to. I know one of my senior folks spoke to him yesterday. We'd be happy to have any number of people speak to him. But let's put the horse before the cart here. We care about the people who've been affected by this disease and their families, and we want to make sure no one else catches this disease. That's where our focus should be.
I guess just to continue with this, just for
If that's what you guys want to talk about, I find it really interesting that the hotel owner's feelings are more important to you than what are we doing to stop a disease, but feel free.
I guess what he was saying was he felt as though they couldn't get basic information from the Department of Health, but then someone leaked to the New York Times.
No, let's be clear. Again, forgive me, guys, but you really got to pay attention to what's important and stop following these smaller stories. This map has been given out to you guys for days. It's pretty clear what the map says. The information was becoming increasingly available. It is a matter of public information. It's our obligation. If we didn't give out information, you guys would rightfully say, why aren't you telling us where the sites are and what conclusions you're coming to? So I'm sorry, I'm not going to allow you to do a double standard here. We erred on the side of transparency and disclosure, and that's the bottom line, and that's much more important than the feelings of this individual.
Mayor, at every press conference I can remember, you've thanked people for their leadership. You've talked about how people are cooperating. You called us into your office a couple of weeks ago to complain that the governor's office was not cooperating with the city. So I'm wondering why you think it's an invalid question to ask whether the governor.
Oh, I didn't say it was invalid. I just said I wasn't going to answer it right now. We're focused on this crisis, and what you should know is that city and state officials are talking constantly and working together. That's what matters.
So why won't you answer the question?
Again, it's my choice which answer I want to give. My answer right now is we're focused on this outbreak, not personalities, not politics.
In terms of the city council legislation, I know you said before you don't have an exact count of how many cooling towers there are in the city. What is the plan to actually find all of these towers and account for them?
Well, the commissioner's order is the first point. The commissioner's order makes abundantly clear that now in the next 9 days that every building owner has to identify and register and clean their tower. So that to me is going to be the first wave. I mean, it's obvious that's the first wave activity. We have had tremendous cooperation from building owners. I've not heard of a single report of a building owner resisting at any point resisting cleaning their tower or inspecting their tower. Again, as I said yesterday, it's in their interest to get down to the bottom of this and make sure it doesn't exist in their building, and obviously it's in their interest to be able to say we found nothing, or our tower's clean and that's certified. So I expect tremendous cooperation from building owners and managers. That will now proceed over the next 9 days. In the course of that, we're going to get a beginning count. The legislation will obviously mandate, not just for existing cooling towers, but any new cooling towers, that they must be registered before they go online. That's another important reform.
Mayor, is there like a division here between the cities handling the impact zone and then the state is doing outside of the impact zone? Is there some sort of division of labor?
It's a good question. I appreciate that question. Again, the two governments are talking constantly, and I mean constantly. Dr. Zucker and Dr. Bassett are talking all the time. Their staffs are talking all the time. My staff and the governor's staff are talking all the time. It's very important to realize that in the midst of a challenge that affects our people, the two governments have a great deal of ability to get together on the practical work that needs to be done, and that is happening right now. We have put our focus on the impacted area, and I want to explain this again. I really want people to hear it, and I appreciate that you've done your homework on this disease. Right now, in cities all over the country and in New York City, there's a presence of Legionnaires in buildings, and it's having no impact, and we're not hearing about it, and there's no reason to even know it's there. This is the first time we've seen anything like this in terms of a concentrated outbreak. As Mary Bassett has said repeatedly, it's a form of pneumonia. Pneumonia is a common part of our society, and Ram, you'll jump in and clarify anything that you think would be additional information. So when the commissioner's order is fully implemented, you will hear about additional locations that have Legionella and have been addressed. And I think in many, many, if not most of those cases, there will be no impact felt by anybody. And that's been true for years and years in this city. Again, this is the only place where we're standing right now, is the only neighborhood that's ever seen a sustained outbreak like this for the first time in 40 years that we've known about Legionella. So I think the bottom line there is our focus has been finishing the work in this affected area. As you know, and the reporting has indicated, even if you go back in the last year, there's been other places in this city where there were smaller incidents, but nothing comparable to this. We deal with each and every one of those, obviously. But the focus here is to, once and for all, get to the bottom of what happened here and make sure that every last piece of the equation is addressed. Meanwhile, the state has brought in resources which we appreciate. They're going in areas around, outside the impact zone, and that's good. That's additional information for us. They're doing additional cleanings. That's all to the good. But the real impact in terms of citywide reach will be that the commissioner's order over the next 9 days will require every single cooling tower in all 5 boroughs to have been cleaned. Then the legislation will set up a protocol for the rest of time for every one of those cleaning towers. So that's the progression.
So the state, if they find Legionella affected those outside of the impact zone, the state is handling the cleanup, it's being cleaned up immediately?
To be clear, I think we can safely say their work is primarily, I don't want to speak for them, you can check with them, but primarily, and Ram, feel free to add, in the Bronx, outside the impacted zone. Neither they nor we are sending teams around the other 4 boroughs yet. So I think there is a complementary effort in the sense of we're in the zone, they're working around the outside of the zone, all to the good. As we go into the next phase, we obviously, as I said yesterday, if we see any building that is not being addressed, we will do it ourselves. And if the state has resources to help us, we would welcome that. But the 2 staffs are constantly comparing notes now on what they find, and we're coming up with a clear, unified list. Do you have anything you want to add?
No,
That's
just want to add that, as the outbreak is tapering, now we are in the preventive mode of finding out other boroughs where this is tower, check them out and make sure they're cleaned. That's what we are trying to do. So we are moving from a phase of managing outbreaks, which is continue to taper. We'll still be concentrating on that, but at the same time, we are also trying to make sure the preventive measure which is being implemented.
Mr. Mayor.
I will do a few more.
You said to the seniors in the other room, I think I've got this right, we're confident the Legionnaires outbreak is now ending. How high is your confidence about that, and what's it based on? What data, what's the lead piece of data that you're looking at?
I'll start, and Ram may want to follow on. I want to also give you one very important reflection, and I hope all of you, I think, want to know what the people are thinking and the mood of the people here in the area affected. Well, I don't know, what would you say, 40 or 50 seniors in that room? One gentleman asked a question, was there some kind of inoculation you could take for this? And the answer is no. We explained that to him. But other than that, literally every single senior I talked to understood that things were being addressed. I didn't see any sense of fear or concern. I saw a high level of understanding of what the situation was and what to do if you had symptoms. So I actually think we should remember something. The people are often ahead of all of us, the media, the government. The people often get the point a lot quicker. I think the people have heard the public outreach over these last few weeks. They understand the situation is being addressed, and they understand what to do if they themselves confront the symptoms. On the question of our confidence, we went into a lot of detail on this yesterday. Based on the fact that it's now been a week plus since we've had a new case, based on the fact that we continually see more evidence that the original sites were the cause, and they were cleaned on July 30, which means that that incubation period is now running out. We have good reason to believe that this is tapering off. No one is saying, a couple of different things, no one's saying there couldn't be a new site, because Legionella is in the atmosphere, and Raman's going to talk about this. I want you to give a little more sense of sort of how this exists in our world and around our city. So of course a new site could develop, but that's true anywhere. Based on this as a concentrated outbreak, all the signs we have that this is tapering off. We will get the test results back from the state, particularly on those original 5 sites, and that's going to tell us a lot if we can confirm our thesis of where this came from, or if we get some additional information. And again, as we go around the city with the commissioner's order, I'm not going to be surprised if I'm giving you updates that Legionella was found in other parts of the city and addressed immediately, and there was no health impact whatsoever. So that's why we're confident, but it's also important to understand it can be in a site but not affect people. Why don't you explain that a little more?
You know, Legionella is in the air, it is in the water, it is in other places, but people don't get sick. Not that everybody, everything. It's been there for many, many, many years, right? Now and then there's an outbreak comes in, suddenly the cluster of patients happens, then we investigate why it happened, where it came from, and try to remedy that. So this is a third most common cause of pneumonia in this country. This is not something unusual bacteria like Ebola. This is a real common bacteria which we deal with almost on a regular basis in our emergency department. To go back to what you said, based on, I'm a scientific guy, based on the epi curve, the data, based on the data what we see, right? And what we see on the front lines in our emergency departments, less number of patient pneumonia. At the height, Lincoln Hospital, which really took care of a greater number of patients with Legionella who came to Lincoln, which was like a hospital which take care of a lot of patients. At the height of this outbreak, we had like 30 patients in the hospital, and 12 of them were in the ICU. Today, we have 2 patients in the ICU. So what is based on what we see in the front line, what the data shows, right? We basically saying, okay, it is tapering off, right? That's what we are trying to say. So I think we need to put that in the right context.
Can you, I don't know if you have
Yes,
this
sir.
answer, I don't want to put you on the spot. It's the third most typical cause of pneumonia. Do you know what number 1 or number 2 are?
It depends on the various communities. It depends on what is in Bronx, maybe different
But just to give
community.
some kind of sense
You know,
of what-
Pseudomonas is one, Staphylococcus is another one, which is common pneumonias, depending on the various places in there, right? There are sometimes we get the rare bacteria like Acinetobacter bacteria comes in. So there are a lot of bacteria which cause pneumonia. And then there is a group of pneumonia which are caused by viruses. That is a big number in there. So we get all these different classification pneumonia. It also depends on the area. Some part of this, it is more common, and some parts, other pneumonia is more common.
Hold on, someone who hasn't gone yet? Yes, sir.
Do you agree with the governor's proposal that there has to be a statewide protocol for this going forward?
I think it would be important after this experience for there to be both national and state guidelines. I think we certainly would have benefited from that in the past. We would have benefited from our own health department having guidelines. So, you know, one of the things I'm trying to say here, and again, I have worked for the federal government, and I've worked closely with the state government for many years. Sometimes it's important to say, you know what, this is new information, and all 3 levels of government did not see previously a reason to address this differently, but now we have all the evidence we need. And we're going to pass the strongest law in the country this week. And from everything we can tell, there's no other major city in America that has a law like it. I suspect you will see other cities start to do the same thing. But I think state rules would be helpful, and I think federal rules would be helpful.
You say that the state and the city are working together on this. How come no one from the state is showing evidence like that?
Again, I want you guys to try to not dwell on the superficial with all due respect. The professionals are talking all the time. I mentioned to you, I was Saturday watching a conversation on the phone with Dr. Zucker and Dr. Bassett. They're talking all the time. The staffs are talking all the time. Sometimes it takes a while to get coordinated. That's normal. Different focal points. There's been a division of labor that's being increasingly worked out. I think you're going to see more and more common information. You saw the release yesterday, the joint release between the 2 health departments. I think you will see increased coordination. The difference here, and it's very important to recognize, between this scenario and the Ebola scenario a lot of you reported on, is we got a lot of warning on the Ebola scenario. We were all prepping and training. I talked about at the time, FDNY had gone through the drills, exactly what they ended up doing with Dr. Spencer. They've been drilling for weeks. The different agencies had all been coordinating, city, state, federal, knowing that New York City might be the kind of place that would end up with it. This outbreak came with no warning. And we were literally well into the outbreak until enough evidence even presented itself to know that the outbreak had reached that kind of level. So I think it's fair to say that sometimes it takes the different levels of government a while to figure out the best way to work together, but that's happening now.
I covered the Legionnaires outbreak this weekend, and I was in the Bronx, and I can honestly say like 9 out of 10 people still don't know. And there is that huge language barrier.
Yes.
Do you think what are you trying to do to overcome that barrier? Because a lot of people don't watch the news. They they don't read the
Sure.
papers, and they don't have internet.
Well, let's be clear, and this is a bigger question of what government can do. We don't pretend that we can like, walk into everyone's living room and have a chat with them. We have to do what we can with the tools we have. We've been going door to door in apartment buildings. We've been going to stores. We've been doing robocalls, town hall meetings, telephone town hall meetings, obviously working with elected officials, community leaders, clergy. That, to me, reaches a lot of people. But I agree with you. There's a certain number of people who don't have internet, aren't reading the papers, aren't going to get the information as quickly. That being said, we have some evidence that the message has gotten through, exactly what Dr. Raju said. Clearly, a lot of people got to care quickly. We saw a spike in people coming for care, and that helped us to turn the situation around. We now see fewer and fewer people who need care. That's a very, very good sign. But I think public information in an outbreak like this is something we have to do constantly. We're doing it, of course, in English and Spanish. And we're going to keep doing it until this is entirely resolved here in this community. I think we also have learned a lot from this experience about a new way of reaching deeper into communities, and that's going to become the template going forward.
Do you think that contributed to the outbreak? Is that why?
The outbreak came because of a bacteria. That's the truth, and one that had never manifested in this fashion before. I have said before that this is a community that has more than its fair share of health problems. We know this. It's a very poor community. It's one of the poorest communities in the country. A lot of people have not gotten the health care they deserved over not just years, in some cases decades of their lives. Yes, language barrier adds an additional complication. I think the fact is this happened for a natural reason, obviously. Our ability going forward will be improved by this experience to make sure that we get in very deeply into the community and get information to people so that we have the best chance of getting them the care they need. But let's face it, I said this is a disease that does discriminate. It has a bigger impact on older people. It has a bigger impact on people with pre-existing healthcare conditions, and that's exactly what happened. It found the most vulnerable. Okay, yes.
Maybe this is a question for the doctor. You know, the mayor said that this is an unprecedented and new situation. The city's never seen it before. Epidemiologically, can you talk about your quest to find out why this is happening and why this is so unprecedented?
Now, again, there's a lot of speculation. We can actually speculate, which I don't want to do. But the fact of the matter is, as I said, the bacteria and the human being exist together, right? Suddenly something changes in that equilibrium. So that immediately start infecting a lot of people. We figure this out, we take care of it, right? That is what the spikes come in. You know, we all find everything, then suddenly there's a spike. Then people get affected, then we get into that, then we clean that up. So this is something which we have seen repeatedly in any kind of infection in the world, not only here, everywhere. But as Mayor said, when these kind of spikes come in, the most vulnerable, medically vulnerable people get affected because they don't have enough resistance as much as a younger person got. That's what we are seeing here. So what we are seeing here is nothing unusual epidemiologically. But the fact of the matter is that 12 people died. It is a major concern to us because there are 12 families, as yesterday Mayor said and the Commissioner said. So we take it very, very seriously. And we really want to make sure that we get to the root of this and clean this up. We believe it worked, so.
I just want to, I think the question is without speculating, any examples or ideas on how something that has been so common could turn into something this big? What types of things might cause that?
You know, a part of it could be, again, we have to find out what is the reason here is. The bacteria changes, is.
Hold on, Ram.
Okay.
Does this guy turn off his phone, please? Come on. Turn off your phones before press conferences, please. Yeah. Go ahead.
The genetic code of the bacteria sometimes changes. It's a slight change in it. So we have antibiotics, antibodies to that particular variety, but when it changes a little bit, we don't have enough antibodies in there. Then it kind of spikes. So a lot of times what happens, the bacteria is the same, it kind of changes genetically a little bit. So we need to find out, but that is one of the causes why a bacteria which has been perfectly fine suddenly gets more virulent and then suddenly has that. We don't know that, but we have,
hold on,
just,
hold
yeah.
on, come on. Don't insult his intelligence or mine. He just said he's not going to speculate, so why would you ask a question like that? Let's be serious. This is an outbreak of a disease. Could we be serious, please, and try and inform people? Last question. Yes, sir.
You said the outbreak had already progressed before the city recognized it, and I think you said previously the outbreak actually started on July 12th.
I don't know if Ram has the breakout of the progression. Again, there's going to be.
What happened
let me finish, please. There's going to be a very extensive after-action report. And the fact is, people contracted this before there was any way to know they contracted it. Then the signs started to manifest. As we've said many times, from time to time, that we would get cases, but they would be isolated and people would recover. Something different happened here. And we've got to get down to the bottom of that. But it took days for that even to be evident to begin with. Once we saw a pattern, that's when all of the testing of the buildings began. That's when the disease detectives started interviewing people. We can get you that exact tick-tock. Again, we can get you, I'm not going to speak about the details I don't have in front of me. The health department will go back with them and get you that exact progression. But the fact is, it did not announce itself. We have had people with Legionnaires' disease before who recovered fine. Something different happened here, and we've got to get down to the bottom of what it was.
I had spoken to an AC tech once, and he speculated that one cooling tower could have infected the others. Have you guys, is that possible, that one cooling tower could have been kind of ground zero and infected?
Again, we're not going to
We're not-
speculate.
we're not
but you
going to
can say- but you can
speculate.
say, if you have a medical explanation of that, if that's even
It
conceivable.
all depends on how close they are to each other, so I cannot really tell you whether they infected each other, so.
Okay.
Have the regular antibiotics,
This is the last one, go ahead.
have the regular antibiotics been working? He was talking about.
Yes, that's right. We have a very powerful, good antibiotic, take care of it. That's why people are getting better.
Right, that's why we have 79 people who've been discharged from the hospital, obviously. For the vast majority of people who have contracted this, they've been treated and discharged with no ongoing impact. So the antibiotics are working. Thanks, everyone.